One thing I've been hearing a lot about in the news in the last couple days since Congress passed the American Health Care Act, which is now off to the Senate, is talk about the Affordable Care Act's 10 essential health benefits. So I thought I would make a video about what these 10 essential health benefits are. To give you a little background, before the Affordable Care Act was fully implemented for individuals and families in 2014, it was really up to states to decide what they would mandate insurance companies to offer as far as insurance. To be honest, most states didn't mandate much at all. So insurance companies could choose what they covered and what they didn't. And people had a variety of plan choices if they didn't get denied based on a pre-existing condition. And some plans covered things, some didn't. And people had a little bit more choice than they do now as far as choosing what kind of plan they wanted, as long as they didn't have a pre-existing condition. That's a really important distinction. Because most people were getting denied coverage, or their prices were being really hiked up because they had a pre-existing condition. But we talk about that in a different video. So the Affordable Care Act was really the first big federal attempt to mandate that insurance companies offering insurance cover certain benefits, and those are the 10 essential health benefits. The first one is ambulatory patient services. So that means outpatient services, doctor's visits, the doctor that you might see if you got a surgery, the anesthesiologist if you've got an outpatient surgery, really any outpatient provider and procedure is an ambulatory patient service. The second one is emergency room services. 3 is hospitalization, like surgery, overnight stays. Number 4 is pregnancy, maternity care, and newborn care. Number 5 is mental health care and substance abuse disorder care. Number 6, prescription drugs. Number 7 is rehab and habilitative services, things like occupational therapy, physical therapy, to help people with disabilities and people with injuries recover from those injuries. Number 8, lab services, lab work, blood draws. Number 9, preventative wellness services, like for women, annual wellness visit for everyone over the age of 50, colonoscopies, that sort of thing. And chronic disease management is also included in there, so people with chronic diseases to be able to get some help with managing those diseases. And then number 10 is pediatric services, so care for children, including dental care and vision care. That's mandated for children, not for adults. So before the Affordable Care Act, I very often saw plans that did not cover a wide variety of these services. I can tell you that back in 2012, I had to find some transitional insurance for myself, and the plan did not cover any pre-existing conditions. Fortunately, I didn't have many. Pretty healthy, and it did not cover any mental health care, maternity care services. It would not cover children. It wouldn't cover any drugs related to mental health services. So things as simple as an antidepressant and anti-anxiety medication. Those were things that weren't covered because the state didn't mandate that those insurance companies cover that. So if the Affordable Care Act is indeed repealed and replaced with this American Health Care Act, it would be up to the state, and for us, the state of Wisconsin, to decide if these services, these 10 essential health benefits, are truly essential, if they should be included in every plan. Based on previous experience with the same administration, I suspect that these 10 essential health benefits would go away. The question is, what would we have left if this does indeed become law? But you should be aware of the 10 essential health benefits and that they exist in the Affordable Care Act and that they did not exist before. Thank you.